So yesterday, junior doctors had this sit-down protest outside Downing Street. Why are they having a protest of all people? They're not the least privileged people in society, and they're definitely not poor.
Right, we need to reduce the premiums that we pay at weekends, make up for it with an increase in base pay. But even after these changes that we're making, junior doctors will get a higher premium for working at weekends than the nurses working in the same hospital, than the ambulance drivers who take people to the hospital, than the porters, than the cleaners. It's a good deal for junior doctors. What we need to do is to make sure that our hospitals are properly staffed at weekends.
So is that what it's all about? Because they don't want to work more weekends? Or is it because they're going to get paid less for working weekends? If doctors really don't like it that much, why don't they just leave? They've all got good degrees.
Record numbers of doctors doing their 2 years basic training and then going off to find a job somewhere else, because 50% now leave to do something else, don't go into the NHS because they are so horrified and demoralised before they even start.
They were told that they were going to be asked to work longer hours. They aren't. We're actually bringing down the hours they work.
What? So doctors are going to have to work less hours and they're still complaining?
History will ask is, did the health secretary, did the government that's committed in its manifesto to 7-day services, did they do the right thing for patients to make care safer and better? And if they did, in the end I think doctors too will say, well, there was a big argument over it, but it was the right thing for the NHS.
Just on the 8 billion you mentioned, the King's Fund says that will not fund this 7-day thing. Most of it's already been spent. So you're going to need more money.
NHS services are going from 5 days to 7 days. Obviously that means there must be a lot more staff, because the doctors are working less hours and you've got an increased service cover. Is that right? Well, it seems that there's not enough money in the NHS and trusts are being told to lay staff off to save money. The reality is NHS staffing levels are not safe, and they haven't been safe for a while. And the result of that, doctors are conscientious people and they will not go home unless their patients are safe. So they end up staying at work and working unpaid hours. That's because their working hours were cut some years ago. Official working hours were cut, but not enough doctors were recruited to do that. You've seen Jeremy Hunt himself say that doctors' working hours are going to be reduced, but we are yet to hear how staffing levels are going to be increased. They've been doing lots and lots of unpaid work to make sure patients are safe for several years now, and that unpaid work has gone completely unappreciated. And up until now, they've not asked for money for that unpaid work. They've just done it to keep their patients safe. But what they can see happening is their official hours are getting cut more, so they're going to get paid for doing less hours. But there's not going to be less patients. Why can't they just do more voluntary unpaid work? They're not the poorest people in society. Well, doctors are human beings, and they've got lives too. At least they would have if they weren't doctors. If they do any more unpaid hours, it's just not going to be worth it for them as human beings. They're already giving you everything they can give you, and a lot of what they're giving you is given to you completely for free, just because of their conscience. Now my question is, why is it them? Why are they the people protesting? If the NHS disintegrates, because at the moment it looks like things are at breaking point, and if it breaks, who do you think is going to do the best out of it? The people most likely to do really well are the private business people running private health services. So how much would a private emergency health consultation cost? For a sprain or a strain, charges have ranged from $4 to $24,000. For a headache, it's ranged from $15 to $17,000, well, over $17,000. Now, there will be some people amongst you who think, because you've got private health insurance, or because you're well off, because you're a millionaire or whatever, that you're going to be okay without the NHS. Now, I'm sorry to break this to you, but when things go wrong in private healthcare, and their patients need to go into intensive care, they send them to the NHS. When it goes wrong, you're going to need the NHS still. If it's not there, there's going to be some trouble. It is time for the general public, it is the time for you to realise why these people are sitting there. They're not doing it for themselves. They'll be fine. They're doing it for you. They're doing it because they're worried about your future. They're worried about your NHS. And they're the wrong people to be sitting there. If the public do not protest now, if the public do not make it clear that they're not happy with the situation, there's no way of guaranteeing that there's going to be an NHS in the future.